macrolides. Macrolides are will be bound to 50S and it will inhibit the organisms. It's a protein synthesis inhibitor. Now it also has an additional anti-inflammatory and immunomodulatory activity, and it is second line to penicillin. So most of the drugs, when penicillin is not working, we always give macrolides because of these two activities also. Now it will inhibit translocation. It's also tacrolimus, the drug called tacrolimus, which is a calcineurin inhibitor. Structurally, it is also a macrolide. That is very important. What are the drugs? Azithro, clerithro, erythro. We also have fidaxomicin and spiramycin. Now, fidaxomicin is what we give in pseudomembranous colitis, along with vancomycin, which is the drug of choice, which is a glycopeptide, and they also give metronidazole and fidaxomicin, which is this a macrolide. And also the last, we have 4 drugs: vancomycin, metronidazole, fidaxomicin, and the last is rifaximin. Rifaximin is also and also there's a monoclonal antibody drug called bezoloctamab, which I'll talk about later. Another drug is spiramycin, which is a macrolide, which is given toxoplasmosis in pregnancy. Now, where do we give all these macrolides? The uses are very important. Most of the uses are we give in atypical bacteria, especially more. Mostly it works on gram-positive organisms, and we can also give on gram-negative. In case of azithro you can give for gram-negative. More of atypicals also you can give. It's also longer acting, so only once a day. Azithro once a day is, if it's given, it is enough. You don't have to have 2 times a day. And also what are the where and all we are using is, azithro is used in STD, gonococcal and syphilis infection, and chancroid, most of the STDs, and also you given chlamydial infections, Campylobacter jejuni, toxoplasmosis, we give spiramycin, especially in pregnancy, Legionella. Typhoid is very important. So these are the drugs that are given azithro, and azithro mostly given sore throat and respiratory infections. What about the 3 drugs, azithro and erythro? Erythro is a powerful microsomal enzyme inhibitor. You should always remember that. What happens is, if you give azithro, it will increase the levels of theophylline. It's an enzyme inhibitor. So if you give it along with theophylline, it can cause coma. If you give it along with warfarin, it's going to cause bleeding. And if you give it along with statins, it can cause myopathy. So that you should remember, 3 things: coma, bleeding, and myopathy. Make sure you don't have these things. So whenever you have the asthma and he's on theophylline, or if he's on warfarin, don't give it, or if he's on statin, don't give it. So that is very important. Also, it can also what happens is, since it's a powerful enzyme, it can cause cholestasis because of the enzyme erythromycin acetylate. That is also there. The resistant mechanism, how it becomes resistant, is with the help of methylase enzyme, which bacteria will have. If that happens, and it will become a methylase enzyme. So what about the uses that we were talking about? One, you can remember it as CLAP, which is CLAP uses. This chancroid mostly used. Cholera, for prophylaxis of cholera, we give mostly doxycycline. Cholera actually doesn't even need treatment, you just have to give fluids. But if you want to give a drug, we prefer more of doxy, so not more of azithro. And another C is chlamydia. We talked about it. Chlamydia, more of azithro, more than doxy. And L for Legionella infections, that is pneumonia, the atypical pneumonia, we give azithromycin only. And the agar, which is used in Legionella infections, buffered yeast charcoal extract. And atypical pneumonia, we talked about azithro and doxycycline. So that is what is there. And P is responsible for I don't think so. P is responsible for pertussis. It is Bartonella pertussis, that is cat scratch disease. You can give this. Apart from that, for typhoid, we talked about clarithromycin. These mostly we talked about azithro. Clarithromycin uses is typhoid. Clarithromycin uses his Mycobacterium avium complex, which we give with three drugs called REC, where R is for rifabutin, E is for ethambutol, and C is for clarithromycin. And H. pylori, one of the drugs, is clarithromycin, and you also give in MDR, TB, and leprosy. So that you should remember. For Mycobacterium bacterial infection, only prophylaxis we give only clarithromycin. That's also important. See the Legionnaires. We talked about the Legionnaires disease by Legionella pneumonia. This also give azithromycin, which is a very good drug. Apart from that, okay, the side effects. The side effects of these drugs in GI, what happens is it can activate the motilin receptor and cause diarrhea. So it will cause more of diarrhea, especially erythromycin will cause these adverse drug effects. And in the liver, it can cause cholestasis because it inhibits the because of the action of erythromycin acetylate, and it can cause reversible deafness. So three drugs will cause reversible deafness. That is, it will cause deafness. That is, you can say it as AMD. A is for aminoglycoside. That is all the aminoglycosides. M is for macrolides, which is what we're talking, and V is for vancomycin, which is a glycopeptide. Also, okay, since these three drugs are very safe in pregnancy, if you want to give any antibiotic during pregnancy, you can always consider macrolide, and you can also always consider cephalosporins and penicillins. So that you should remember. Now another drug is called clindamycin. Clindamycin is secreted in bile, and it's a lincosamide. That is also very important. It is also going to inhibit 50S ribosomes. What are the uses of clindamycin? It's not only used for acne vulgaris. That you should first remember. The first, clindamycin can be used in toxic shock syndrome with this clindamycin and vancomycin. Vancomycin is the glycopeptide thing. And osteomyelitis can also be given. Good anaerobic infection. See, anaerobics, most of the drugs can inhibit anaerobic infection. So this is also a good anaerobic infection. And one you should remember, above the diaphragm drugs, most of clindamycin is used, and below the diaphragm metronidazole is used. So that also is important to remember. Below the diaphragm, peritonitis, pelvic inflammatory disease, which is mostly will be resistant to clindamycin, so you can give metronidazole, for definitely for acne. And the other thing is for gas gangrene, we also use clindamycin and penicillin G. So that is also very important. And the adverse effect of clindamycin is very important. Adverse effect of clindamycin is what will cause pseudomembranous colitis. Like I told you, pseudomembranous colitis is because of more of antibiotic exposure, especially third generation cephalosporins and clindamycin and ampicillin, all the broad spectrum penicillins also fluoroquinolones, clindamycin. All these drugs can cause pseudomembranous colitis. The best drug is the oral vancomycin. The second is the metronidazole. The third is the fidaxomicin. I told you, fidaxomicin is what? It is a macrolide. Clindamycin is a lincosamide, but fidaxomicin is a macrolide. So fidaxomicin will help in preventing relapse, and the other drug is the rifaximin. Rifaximin is the fourth drug. That is also you remember. The monoclonal antibodies that can be used for Clostridium difficile infection is beslatoximumab and acatoximumab. That's it.